Hi, all, and welcome to the Holistic Ascent podcast, where we talk about specific wellness tools, resources, and practices to become more empowered in our wellness journeys. I'm Lexie Haren, and today I have the pleasure of being joined by Christina Walsh, physical therapist and co-owner of Tighten Your Tinkler. A New Orleans mama of two living with pelvic floor issues, Christina is a physical therapist specializing in integrative manual therapy and the co-creator of Tighten Your Tinkler. Christina and her co-founder Jenn Lormand have a combined 36 years of experience supporting postpartum women holistically through prolapse, diastasis, recti, and more. Their proprietary protocol helps women solve pelvic floor problems without kegels or internal vaginal devices from the comfort of their own homes. Christina's mission is to free more mamas from embarrassing pee leaks, chronic back, hip pain, and painful sex, and in doing so, help them to restore their dignity, functional strength, and trust in their own bodies. Welcome, Christina, to the show. I'm so excited to have you here today.
Thank you so much, Lexie. I'm excited to geek out with you about a topic that is very near and dear to my heart and my personal experience.
Yes. Oh my goodness. Okay. So, I guess starting with that, how did you get into working with women on their pelvic floor health in the first place?
Oh, great. Like so many of our paths and like yours and like so many of your guests, it was truly guided, and took twists and turns I could have never anticipated. I never intended to work in this field per se. Like I was kind of more of an orthopedic PT, and I did hospital PT and home health PT. And then I had a neck injury, and you're thinking, what does that have to do with pelvic floor work? And, it comes around full circle, which the neck injury led me to a specialized type of body work called craniosacral therapy. I still maintain a practice doing that work.
Okay.
And I was gifted meeting my now business partner in our business, Tighten Your Tinkler, which is the pelvic floor work, Jenn Lormand, who is an exercise physiologist extraordinaire who was healing from her own birth injuries. And then we kind of like sparks flew when I met her, and I really helped her to begin recovering. And she invited me to practice in her personal training gym. She was like, all the women I work with, she was already doing a lot of postnatal work and then also rehabbing her own birth injuries. And I went to practice with her, and it was meant to be. And then like two separate businesses. And then I had a couple of kids and had my own recovery issues to deal with down there. Okay.
Yeah.
Right. And so then the two of us were like, we did not like any of the options that were being offered to us. Major pelvic reconstructive surgery. We had tried Kegels. We had tried pelvic floor therapy. None of that was working for us. And we were like, we're nerds for what we do. We love the body and the science and the biomechanics. We are not like hip and trendy, but we love what we do, and we love going deep with women to heal. And we did it first for ourselves. We were like, there's got to be a better way. Like, it doesn't make sense as a physiologist yourself, right? It doesn't rationally make sense to isometrically hold and squeeze a muscle and expect functional change in all the ranges of motion that muscle needs to work in, right? So like, no wonder Kegels weren't working. They didn't work for us. And we were really, really bound and determined for ourselves and then for all the women that we were going to work with to find a new way. And so that's what set Jenn and I together on a mission to create change. And we did discover an entirely new approach that worked for us. And then we had the harebrained idea to test it with medical research, because that was going to be our big splash in the world. We're like, we're going to make change. Like, testimonials are great, but like, we're going to change the system. We're going to do research. We tested our protocol. We did not know what we were getting ourselves into, but we did 3 years of research, and we were published in a peer-reviewed medical journal, which we thought was the end at that point. And then the women in our research came back to us and were like, please make videos of this. Like, everyone I know needs to be referred to this so that their lives can be changed like mine. And we were like, we need to listen to these women.
Wow.
And
that's incredible.
We created Tighten Your Tinkler, and one of our clients named it for us. The tagline is silly name, serious results, because we always want to approach these issues with women from a place that is not scary, that is heartfelt, but also serious. So we want to combine all those angles because it's so intimate and personal. It needs to be relatable, and it needs to be less scary, and it needs to feel hopeful. And that is what I want for anyone listening, to feel a sense of hope after this, that if you are dealing with issues now, or if you face them in the future, that you feel empowered, not scared.
I love that. And I just think like the first time I was scrolling through your Instagram and it was like all these super fun, energetic videos and it like Tighten Your Tinkler, like the tagline, it really helped me like take a step back and feel like, oh, this can actually be like fun and enjoyable to like work on our health of our pelvic floor and like move forward with these often very touchy and sensitive like, subjects. And so I just so appreciate the approach that you all have taken to this to like, empower so many women in this way.
Thanks so much, girl. That is our goal.
Yeah.
It's walking that fine line between demystifying and taking the fear out, but also acknowledging with real seriousness how impactful these issues are to us as women and our sense of well-being and wholeness. And so it's threading that needle so that it's less scary and there is that sense of hope.
Yes. Oh my goodness. Someone thinks they're experiencing pelvic floor issues or their pelvic floor could use some TLC. What would that look like? Like, how do we even identify that?
Yeah, oh, this is a perfect first question
Great.
because there are a lot of myths about this. And I think Jen and I never ever want to throw another healthcare provider under the bus. Everybody we believe gets into the healing professions because they want to help people, but we don't know what we don't know. And
Yeah.
that applies to all of us. And so we believe that the stories we hear under our YouTube channels and our inboxes every single day, it's amazing how similar women are being told things are normal, that they should ignore them, that they should just live with it and accept it because, well, you're getting older. Well, you had a few kids. Well, whatever. And none of that's true. So I would go through a nice little list of the things that, maybe we laugh about because we don't know how to fix them. And maybe that helps them feel less scary. Or maybe even a doctor told us, well, it's normal. Oh, your mom had it. So, well, I guess this is just what it is, but it doesn't have to be that way. Only you can decide when you're ready to take action to make a change. But the message of hope is none of these things have to be your new normal. And they include leaking pee of any kind, whether that's laughing, coughing, sneezing, jumping, or the kind where it's like, oh my gosh, I got to go, but I got to go now. And there's not time to get there. Getting up at night to pee. This is like boggles women's minds. It is not something you have to live with. It's amazing how fast that one gets better with the right functional care. Women are absolutely shocked. They join for the leaks and then they message us a week later, like, wait, I didn't get up to pee either. And we're like, yeah, we told
Wow.
you that was going to happen. And they're like, I know, but I didn't really believe you because I've been doing that for so long. It's amazing how much we just accept because we don't think there's another way.
Right.
So, and sleep, right? How important is that to the rest of our entire body? So if you can get a full night's sleep again, that's fantastic. No amount of that pressure or heaviness is normal. Now, this isn't usually one of the first symptoms. It's, when it's a little more progressed or after you've had kids, it's this feeling of like pressure or heaviness or fullness down in the pelvis, almost like you're at the end stage of a pregnancy, but you're not anymore. That can be a symptom of pelvic floor weakness, dysfunction, or even prolapse where the organs start to fall and shift out of place. That's like the next level of pelvic floor dysfunction. Another thing that is not normal and that is connected to all this is back and hip issues, right?
Okay.
Our core, our abs, our deep abdominals, our low back extensors, our outer hips, our pelvic floor really need to function as a unit and without us having to think about it. So if you have an old back injury, or if you just find you're like one of those folks who kind of chronically overuses your hip flexors, all of that is connected to, you could call it core dysfunction, even if you want to kind of zoom it out a little bit more. And it all needs to work together as a unit. And none of that is stuff you have to just accept. And it is all connected. So don't let anybody tell you that it's not, or that it's in your head. You know your body. Also, pain with sex. That is not normal, not something you have to live with. And there are different types of the ways that can present. But again, also not something that's normal that you have to accept.
Yes. Oh my goodness. I feel like these are all things that I have had so many women come to me talking about. I feel like most women are dealing with one of these issues.
Yes, and I think that's part of the problem is that it's hard to talk about. And then, like I said, the sad stories, and this happened to both of us, you get the courage to bring it up to your physician, and you get, not always, but surprisingly often, women are shamed and dismissed. So then you really give up. Like, oh, well, I guess this is just it for me. And no, the answer is there is hope. Yeah. So, and
Yes.
so many women are dealing with this stuff. And that's why we want to get out there. Like, when you decide to take action to solve these problems is up to you. But we really want you to hear what you don't have to accept all of this. So whenever you decide to draw that line,
Yeah.
just know that it doesn't have to be like this.
Yes, I think that's so encouraging. I know even in my own story, I have been referred to like pelvic floor therapist, and I haven't even booked my appointment yet because honestly, I'm nervous. And that was like 6 or 8 months ago, actually, probably even longer ago. But one of my main things is like chronic pelvic pain and then low back and hip issues. And like I always attributed it to like my major hip surgery I had in my 20s, which part of it probably can be, but like
Yes.
a lot of it, it's all connected down there, like between my core, my hip, my back, my glutes, everything like that. But like scary to talk about. And like you don't want to talk about like having pain with intercourse and things like this, but so many women are. And sometimes when you go to talk to your doctor, they're just like, oh, it's just you need to take a medication for this or you need to be put on birth control. And it's like,
Yes.
no, there are other options out there. Um,
Yes.
and I think what a big fear component for me is like, I don't want to go to a pelvic floor therapist that's going to like make me stick things up there and do like internal work. That freaks me out. And I think just the
Yes.
unknown. So, would you talk about a little bit about what you all do and how it's different than like, what we might think a traditional pelvic floor therapist would do?
Yes, and look, I also won't generalize. You know, there
Yeah.
are different standards of practice in different parts of the country for pelvic
Okay.
floor therapy. So, but what many women who end up coming to work with us have found is that they either, it's a moment to tune in and to know yourself. So
Yeah.
most pelvic floor therapists, there will be a component at least of internal work, of intravaginal devices, or even manipulation, pressure point releases, or, Jen and I don't believe any of that is necessary, quite frankly,
Right.
because we've proven that it's not,
Yeah.
both by the data and by all the testimonials and success stories and our own personal journeys, that doesn't have to be the way that it goes. Now, tune in and listen to your heart and your gut. So
Yeah.
we have a solution that's very different. It's whole body functional movement.
Mm.
And that re-strengthens and reactivates the pelvic floor, the core, the outer hips, the low back, the deep abdominals all at once. So with our approach, you learn relief techniques to kind
Mhm.
of decompress the nervous system, stretch the muscles gently, and then you learn the activation muscle reactivation and strengthening series. And it is all external, and it's something you can do from home. Now, we are not the right fit for everyone. That's
Mm.
okay. So like someone like you who's like, gosh, I'd really rather not go that route.
Yeah.
We're a great fit, right? This is
Right.
something you can do from home that doesn't require you taking off any of your clothing or putting anything inside your body. So
Yes.
great fit. If you're somebody listening who's like, this maybe for some women, kind of doing something on their own feels scarier and they want to be in person with someone. That's
Right.
fine. Like, what a great gift that there are options now. So if you're, a lot of the women who come to work with us, like I said, maybe they have a history of sexual trauma or birth trauma, and the
Yeah.
idea of being penetrated with a foreign
Yeah.
device is unacceptable, or they just don't
Totally.
want to go that route, or they want to take their health into their own hands.
Yeah.
Those are the types of women who end up coming to work with us, or they've already tried that and it didn't work.
Yes.
So I know that approach works for some women. So
Yeah.
that's great, but we're just so honored and grateful to be able to provide an alternate option that definitely also works.
Yeah, I feel like that's so encouraging for me and so many other people.
Your intuition, I mean, is so spot on. Like, you already knew. You're like, all this
Yeah.
stuff with my hip and my back, it's totally connected. And yes, it absolutely is. So that's the other thing is we always want to tune in. As women, we're gifted a really brilliant, beautiful sense of intuition. And you know your
Yes.
body. Like, if you feel like something's not right, then it's not. I don't care what anyone else says, you know?
Totally.
Yeah.
1000%. Yes. Oh my
And
goodness.
there are so many things that every woman can do to gently nudge things in the right direction for pelvic floor health. And some of it, it's all holistic approaches. Some of it is things that we also teach inside our program, because we're always going to, as a holistic approach, you pull back the viewfinder. You look at the whole system and the whole body and the way the pieces and parts interplay and interconnect. And so that's part of what we do inside the program. And I can give tons of little tips and tricks as far as like things you can start and stop doing to move the needle in the right direction whenever you want.
Yeah, that would be great to dive into a bit because, like, first off, like, one of the myths you love debunking is like, why are Kegels so bad? And you already touched on it briefly, but would you mind digging into that a little bit more? Because we've always been told Kegels, do
Kegels, well,
more.
and like I said, I think people who are recommending that are doing it because it's the best thing they know, right?
Yeah,
But there's a better
totally.
way. And
Yes.
so it doesn't make sense. The best analogy I love that Jenn actually talks about is as if you went to your personal trainer and you were like, I need my biceps stronger to lift some heavy boxes. And they were like, okay, hold your elbow in 90-degree bend and squeeze and relax your muscle again and again and again. And it's like, well, okay, you get stronger in that one position, but it's not really
Yeah.
going to help you lift those boxes. And
Hmm.
that's basically what Kegels are doing. It's
Right.
isolated squeezing, but we need our pelvic floor to work in all the ranges of motion. We need it to work in a deep squat when we sneeze or when we're driving and we can't really cross our legs without causing an accident. Or,
Yes.
it needs to be functional strength that is not something you have to think about. Look, before the pelvic floor dysfunction started happening, I would wager no woman had to think about her pelvic floor for it to work properly for her when she sneezed, coughed, laughed, jumped. It just did, right?
Hmm.
And so Kegels make it a conscious thing, which it never was supposed to be. It was the best that anyone knew for a long time. So I
Right.
get that. But there's absolutely a better way that takes the conscious piece back out of it again and really just teaches the muscle to fire as it did before it was injured, before it became dysfunctional. So it doesn't have to be Kegels. And that's why they don't make sense, is because you're strengthening in this strange, isolated one position. And what they often end up causing, for all the women who come to us who've tried that and it didn't work, it often ended up making things worse
Hmm.
because it actually ends up causing over tightening in that one
Right.
spot or that one position. And I mean, this is like really nerdy muscle talk, but like I know
Yes.
you'll hang out with me here for a
We
minute.
love it.
That like the little sarcomeres in the muscle, those little finger projections, if the muscle's over tight, they also can't grab and generate the force that they need to. So an over tight muscle is still and also is a weak muscle. Right. So I
Right.
think it's a
Yes.
common misconception, like, oh, it's over tight, that means it must be really strong. It's like, nope,
Yeah.
actually it needs to be stretched and lengthened and then re-strengthened once it's in a more comfortable, natural position again without over and retightening. So you want to build
Yes.
strength, not tightness, right? I mean, I know
Yes.
our business name is
Totally.
Tighten Your Tinkler. We want it to be
Yes.
cute and catchy without being
Yeah.
crass, but like,
Right. No, I
um,
appreciate this perspective too, because I think as women, sometimes we have like a really hard time just like letting go. And maybe I'm just speaking for myself, but like
you're
I
not
feel like that's
alone.
one of the hardest parts is like almost over constricting certain
Yes.
areas, whether it's for a bowel movement or whatever. There needs to be an
Yes.
equal balance of release and control.
Yes, absolutely. And that's
Yeah.
incredibly common. I'm glad you brought that up because I know
Yeah.
you are an athlete and so many women who are listening are high-level athletes, and that
Yeah.
is a population who is at risk for that over tight muscle
Mm.
because of the types of intensive training that have been undertaken. And also, I want to zoom back and even pull back to the lifespan of all the factors that influence that health and that state of our pelvic floor muscle, because it's also connected to our fight or flight system. So whether it's a lifetime of physical stress and pressure from something like a history of chronic constipation or chronic coughing and asthma, constantly downward pressing on that pelvic floor, causing it to reactively tighten to guard, or whether it's a history of, again, sexual or birth trauma, whether it's a history of high impact strength and exercise training, which caused it to over tighten over time, or whether it's a history of just living in a state of like you are a high achiever, you're a go getter, you tend to run maybe a little more high anxiety. All of that over time impacts the condition of the pelvic floor. That's before you have a kid,
Right.
you
I can
know?
attest to that. No kids,
Yeah.
and I still got issues.
Absolutely. So the best place
Yeah.
to start, if you're like, oh my gosh, that is me.
Yeah.
If you're having pelvic floor issues and you've never had a child and any of those like markers rings true, the best place to start is relaxing and releasing. And we have a wonderful free technique that everyone needs to have access to. It's called the 90-90 decompression is what we call it. It's a position you put yourself in the comfort of your own home for 10 minutes. You add the breath work that we also teach in the video. You're going to be giving your nervous system a reset. You're going to be offloading your pelvic floor and offloading your back and your hips all at the same time. So I call it rest multitasking for my high achievers out there.
Love it.
My ladies who always need to be being productive, and I understand. So you are going to be multitasking while you do this restful position, and it is going to be a gift to your pelvic floor and your nervous system and your back and hips all at once. And that is a perfect place to start.
Wow, I love that. Is this a video on YouTube or on your Instagram, or where can we
Well,
find it?
I'll make sure to give you the link.
Okay,
We have it through, you just sign up, and then we get sent
cool.
straight to your inbox along with like coaching tips to make sure you can dial it in and make sure to get it just right for your body. Because once you get it in that position, you're just like, you can feel your whole, it's like that feeling when you get a great massage where you just feel your whole constitution just kind of exhale. And
Wow.
it's such a gift to your body on multiple planes and in multiple places.
Wow, I love that. Okay, I'm excited. I'm looking forward to trying this now.
Girl, it feels so good. And it's a little sampling from what's inside
Yeah,
of our program, because it's not just the exercises that create the lasting functional change. It's
right.
that decompressing and releasing combined with that functional strengthening. That's like, that's the gold. So
Yes,
you got to start
yes.
with the decompressing. And you start with other really accessible action steps that anyone can start doing. Something as simple as fiber and hydration, right? It's going to pay
Mm,
dividends in lots of other ways, but that is a gift to your pelvic floor,
yes.
because straining to get your poop out is really not kind for a pelvic floor. So you're going to want to make sure you have a toileting stool. So
Mm.
if you haven't already, get thyself squatty potties around all
Yes.
of your toilets.
Love squatty potties.
Oh, they're the best, right?
Yes.
And they even make pretty ones. It used to be like, people would be like, I don't like that medical device. I'm like, no, they have bamboo and teak, and they can be really pretty now. I have them in all of my bathrooms. And so something like a squatty potty will actually help more fully and completely and gently empty the bowel and the bladder. That's a wonderful gift to your pelvic floor, along with your fiber and your hydration to keep your tissue plump and happy with that hydration. And then the fiber, of course, keeping those bowel movements not too hard, not too soft, so you're not straining. And then you've got that ergonomic emptying position with your squatty potty. All these things are little checks and movements in the right direction for your pelvic floor. You can do your breath work daily. I loved your recent interview with Amy, was so on point and aligned with the breath work that we teach in that decompression position that will make sure you have access to, because that's part of that rest and relaxation and resetting the diaphragm, the pelvic floor. They need to kind of move together gently with breath. So all of this is that holistic picture of just gently taking care of this area as you're setting it up for success with each one of these little action steps that you're taking. Other simple things you can do are just listening to your body. If you are doing something or even wearing something maybe too tight around your middle, that's like squeezing and putting downward pressure down there. If you're noticing something you're wearing or something you're doing is increasing any of these symptoms, back, hip discomfort, downward pressure or heaviness, leaks, that is your body being like, oh, please no, like not right now. This is not a gift to me right now. And so
Mhm.
you can pull back, modify, do some self-care work for the pelvic floor, whether it's decompressing or strengthening, and then come back to that activity and see how it responds once you've given that little area a little TLC that it needed. So it's not necessarily that you can't ever do or wear those things again, but it would be a gift to your body to pause them if you notice that it's causing increased symptoms. That's your body being like, ooh, not right now, please.
Right, most definitely. I mean, I don't think I would have necessarily thought about that, just wearing tight pants or like squeezing into those jeans or
Right.
whatever, but that can affect it. And I wouldn't have really considered that before. So that's a really
Totally.
interesting perspective.
Totally. And I have a reel about it. Jenn, again, she comes up with the best analogies. And that's why I had to make this one into a reel of if imagining your core is like you've got a toothpaste tube and you turn it upside down, and you've got that loose cap on the bottom as your weak pelvic floor, and
Okay.
squeeze the middle. And where does the pressure go?
All the
Right
way down.
out the bottom. So if you're compromised already right there and you're adding squeezing in the middle, that pressure's got to go somewhere.
Yes.
You
Okay,
know?
well, this is interesting because now I've got like so many wheels turning, but can a weak pelvic floor actually like contribute to imbalances in hormones and like hormonal issues like endometriosis and things like that?
These are great questions. Often it ends up being related.
Right.
But I wouldn't say the weak pelvic floor isn't like contributing to or causing the endometriosis, because
Okay.
that's something like a whole separate situation that's happening within the uterus itself. But we do know that pelvic floor, like the tissue quality of the pelvic floor, is affected by our hormones. So maybe
Okay.
it kind of goes the other way,
Yes.
that a lot of women are kind of like, well, the issues didn't really bother me that much until I hit that threshold of like perimenopause. And then the tissue changes that happen with the hormones cause all the symptoms to just get that much worse. And they're like, okay, now I can't live with this anymore.
Wow.
So that can happen.
Okay.
And our threshold of what is enough or what is too much is so personal.
Yeah.
We have women come work with us at many different stages of issues, pain, and dysfunction, because how much is too much is dependent on you.
Hey, it's Lexie. I hope you're enjoying this episode so far. This episode is sponsored by Haren Holistic's Functional Labs and Homeopathy. Haren Holistic's goal is to bring empowerment back to you in your wellness journey. By using functional lab tests like the hair tissue mineral analysis, Haren Holistics is able to provide you with individualized protocols that are unique to you and your life circumstances. You can learn more about working with a qualified practitioner through Haren Holistics by visiting HarenHolistics.com and finding the service and booking guide, also available here in the show notes. Mention the Holistic Ascent podcast to get 10% off your services. Now, let's get back to the show. Are there things that we can be doing even if we don't think we have pelvic floor issues right now that could prepare us, like if we wanted to try to conceive or if we wanted to just prevent anything down the road? Just applying tips that you just talked about?
Totally.
Okay.
Totally. Especially if you heard part of your story and any of that list of kind of risk factors about like the chronic constipation or asthma and coughing or
Yeah.
high anxiety job or history of trauma. Like if you are knowing that you're wanting to have children down the future, or you're going to ask a lot from your pelvic floor, maybe in that way or another way,
Right.
start that decompression position daily. Make sure that you are adding that breath work in, being kind to your pelvic floor through that toileting stool use, the fiber, the hydration. All of that can really set you up better for success down the road, to make sure you're not going into a pregnancy with a hypertonic, overtight pelvic floor that's going to be more likely to be injured through that. So those things definitely matter.
Okay. Yes. Okay. Some of the other myths that I wanted to talk about around the pelvic floor. Does a small bladder actually exist?
Oh, I love this one. Absolutely not. All right. The bladder holds between 4 and 6 cups of urine. So if you do the ounces math, no amount of numbers of reasonable cups of water or ounces of water per day can, peeing more than 10 times a day is not normal. Like
Okay.
no amount of water you're drinking. What it is an indication of, it can be two factors. If you have that pee frequency situation happening, it's usually a component of weakness in the pelvic floor, but it's also a component of that nervous system connection being really heightened into that fight or flight state, because the bladder is connected to that nervous system. So it can be strengthen the pelvic floor and then do your decompression position or whatever it is that brings you out of that fight or flight state, whatever care that is, whether it's meditation, prayer, yoga, whatever. Pour into your nervous system that kindness and gentleness, because that is generally a part of that peeing more than 10 times a day, along with the pelvic floor weakness.
Okay. Well, what is a normal amount of times that we should be peeing as women every day?
Just 10 or less is anywhere in that range is normal. I mean, and we completely agree with all the general recommendations for hydration. If you can get your 8 glasses a day, and I mean, we often recommend half your body weight in ounces of water. And we also love to add electrolytes. I'm sure a lot of your athletes are already doing that, but that actually really does. I mean, it really does help our body. Not only does it help with the balance that we need for our muscles to function well, but it helps your body make better use of the water you're drinking. So it's not just running right through you. So for any woman who's dealing with pee frequency, like, oh my gosh, I don't want to drink anymore. Or if you're getting up at night to be like, I don't want to drink anymore because I'm going to have to go to the bathroom even more. Well, first of all, dehydrated urine is a bladder irritant. So you're not doing yourself any favors if you dehydrate yourself. And second of all, you want to keep drinking that water, but add electrolytes, because if we're not adding those, the water might just be running right through you and getting absorbed less. So all those little tips and tricks make a difference.
Okay, does pelvic floor health like directly impact the frequency someone might experience UTIs?
Girl, I love this question
Because
too.
I know
Okay,
so many
because
people that struggle with recurrent ones, and they're like, I'm just
yes.
prone to it. But
And right, but then what? Then what
yeah,
is the rest of your life like on
yeah,
antibiotics with a wrecked GI tract? And
no.
we know how much that impacts. The GI tract. We're learning so much now is so health there is so important for the entire rest of our body. So you don't want to be on antibiotics forever,
No.
and be wrecking your gut flora and fauna constantly. So
Yeah.
absolutely can be connected. This is fascinating. And we have
Okay.
so many women who have joined us and then achieved that decreased UTI frequency because the bladder, if it's not completely emptying, you're having
Mm,
residual urine left in there. And that absolutely sets you up for recurrent UTIs. So
interesting.
something as simple as getting that squatty potty to help completely empty your bladder, making sure you're not pushing your pee out. I don't
Mm.
care how many seconds you think you're shaving off. Gently relax to let it out. Put your feet up on that squatty potty for that ergonomic emptying position. And even exhale. If you're like, I think my pelvic floor is over tight, I don't feel like I'm completely emptying. Give a good as you're
Mm.
peeing and close your eyes if it helps. Rock back and forth. See if that helps you get a
Mm.
little bit more urine out as you're relaxing, swaying back and forth. You've got your squatty potty, you're exhaling so you can more fully and completely empty your bladder, because if there's residual urine in there, you absolutely are going to be more likely to get recurrent UTIs. So a completely empty bladder is much less likely to have that. Another thing you can try is if you do have those recurrent UTIs, is keep a little peri-wash bottle by the potty, and you can even put a little Epsom salt in there and just irrigate the
Mm.
area, not internally, externally,
Yeah.
every time after you pee. And that can help decrease that frequency of UTIs as well. So between more completely
Wow.
emptying your bladder, adding that irrigation with a little warm water and Epsom salt, both of those things can make a huge difference and get you off of that chronic antibiotic use, which is no good.
No. Yeah, that's amazing. I never would have thought about that, completely emptying the bladder, but it totally makes sense from like an anatomical and physiological level. It's like,
Totally.
oh,
Yeah.
wow.
And when you get that undercarriage strengthened and everything is
Yes.
supported in that up and in sort of fashion again, the organs are going to be more in the right place, and that complete emptying is going to happen even more naturally. It's amazing how connected all this stuff really is. And we know that
Totally.
intuitively, right?
Yes.
As women. And I think we've been trained to not listen to our bodies in some ways by things that we've heard and things we've been told. Um, but your intuition is right. It is connected, and there is help to heal, and it doesn't have to just be like all of this.
Yes. Yes. I love that. How quickly are women like experiencing upward trends in their pelvic floor health through your program?
Oh my God, it happens in days.
Okay.
I
Wow.
mean, it's different for everyone, but most women start to notice the positive changes within days.
That's
And
amazing.
within a few weeks, it's significant. Within a month, it's huge. And then, it just goes upward from there, because you start to notice one thing gets better, and then you can kind of direct your attention somewhere else and kind of tune in more to that other symptom. And as you heal, it becomes this upward spiral. And so many women, like I said, they join for one particular issue, and come to work with us for that issue. And then much like, right, just any holistic approach, just like the
Yeah.
ones that you take and coach women through, it becomes that rising tide lifting all boats,
Yes.
because when we gently nudge our body in the direction it already wanted to go, right, which is what holistic healing is all about. It's tapping into our body's original innate healing ability. Like, our bodies are so smart. Sometimes we just need
Yes.
to give it that little oop, go this way,
Totally.
and then everything in that area starts to get better too. And that's the thing that women are shocked, like, wait, the leaks are getting better, but now I'm not getting up to pee, and now I'm not constantly having to stretch my back. Like, they're
Wow.
just dumbfounded because we've been told to break those up into separate little boxes, but they're
Yes.
not.
Totally. Totally. I love that whole body approach and everything. It triggers this cascade effect, like you're saying, and that just is so encouraging in
Yes,
someone's healing journey.
absolutely. And then, I mean, it's all the mental emotional piece, especially
Yeah.
when we're talking about our center. I
Yeah.
mean, to feel broken there is devastating. And Jenn and I have walked that path, and that's why we're here, is that it's not just the physical relief. You start to feel a weight lifting because you're frightened. when things aren't right down there at your center of gravity, at your energetic center as a woman. And then you start to feel hope again, that you're not going to have to live the rest of your life feeling broken, like your body betrayed you. Like, I thought I was meant to do this or that or this other thing. That's the weight that comes off of your energetic being is huge.
Yes, a huge burden lifted. That's
Yes.
incredible. So hopeful. Oh, this is so cool. I feel like I've learned so much from you already. And I have a few listener questions, if you don't mind me asking you some of those right now, because I love to just get into what can specifically help some of my listeners. So the first one is, can pelvic floor work help build up the uterine wall that has thinned post-menopause?
This can be tricky. We have lots of women who have joined us in, you might say, those later years, and it can be a journey that requires a little more patience because we are having the effects of hormone shifts on the tissues, and that can't be necessarily reversed. But the beautiful thing about our bodies is that they're always also capable of positive change and of strength gains, no matter where we are. So it absolutely can still provide meaningful relief. We just always, setting expectations is really important, especially when we're tackling something so personal. So we want to be upfront that the longer the issues have been going on, the more patience we need to give our bodies to find that reset and to see that major shift in positive progress, although nuances of positive change should come quickly if the approach is the right fit.
That makes sense. And are there still things that someone can do if they're pregnant right now and they still want to work on strengthening their pelvic floor during pregnancy?
This is such a great question. So we have had women work with us through our signature program during pregnancy, but what we always mention, so it depends on do they mean like I'm already dealing with pelvic floor issues, or I just want to be proactive, because it's kind of two separate. If you just want to be proactive, the best thing you can do is, quite frankly, focus on the rest, the relaxation, the stretching, and the birth plan.
Okay.
Because so much of this happens because of birth and recovery that may not have gone optimally. So we always recommend women spend that time focusing on your birth plan, setting yourself up to birth in a place that feels safe, where you feel supported with the people and the surroundings, because that will matter so much. We can't control how birth goes, obviously. But when we set ourselves up for success in how safe we feel when we birth and how supported we feel, how comfortable we feel, it's a huge win in stacking the scales towards the positive, hopeful side of not ending up with injuries and things that cause problems down the road. So focus on that. The rest, the relaxation, that energy of birth, that is the letting go, that is the surrender. Because that's where we help prevent injury in that birth process.
Oh, I love that. And if any of you are listening and you want to dig more into like the pregnancy, like pre-pregnancy and like postpartum topics in regards to this, Christina has been on so many other like birth podcasts and things like that, where you can like dig into all that too. So I mean, we'll probably do a whole nother episode just on that, but
we love, happy home birth. Oh my goodness, is wonderful. Yeah, there's so many good ones. And there's tons of teaching on our YouTube channel. We have spent years amassing a collection of resources there, because we know how scary it is to even Google some of this stuff. And so chances are, if you're scared to Google it, we have a teaching on it on YouTube. So
I love that. Oh my goodness. Good. Well, so what does your program specifically look like if someone wants to start working with you?
Yeah, it's whenever you want. It's always available to join. We call it a DIY program. It is all online. You get lifetime access to the resources there and all future upgrades, because we're constantly making changes and improvements based on what our members share with us about their results and their experiences in the program. We call it DIY because you can't call us up on the phone and be like, hey, here's my problem. But it's not really. There is absolutely a lifetime access membership to our support group as well, which is active and a very special corner of the internet, because every woman in there knows what it feels like. And you get guidance from coaching from Jenn and I, live teaching in there once a month. And you also get to connect with women maybe who are a few steps ahead of you on that recovery journey and hear the success stories as they share their wins, and connect with women who are in the same place as you, maybe struggling with the emotional piece of what this has all felt like and what it has done to your life. And so you get the hope, you get the companionship of those who know what it feels like, and you get the coaching in there as well, on top of the entire course that walks you through those relief and recovery techniques, and then also those exercises. And all of that comes with, as long as you've got it forever once you join.
Very cool. Oh, that's so encouraging. I love it. Well, thank you so much. I don't know if there's any last tidbits of advice you would love to leave with the audience. Like, there's one or two things you would recommend just doing right off the bat today to support our pelvic floor health, but I kind of like to leave with a few tips like that.
Absolutely. I think the most important part is to tune into your intuition and how you feel in your own body.
Yeah.
Because again, we've been, most of us, flooded with messages about what should or shouldn't be, what is or isn't right. And only you really know what feels right in your own body and what is and is not acceptable for you to live with. And that's the most important piece when navigating any healing journey, and trusting your intuition with whoever you choose to work with as your provider to escort you on that next part of your healing journey. It is personal. And so ideally, it's someone you feel personally safe with, so that you can really receive that support whenever you decide you're ready.
I love that. Thank you so much for sharing your wisdom and just your bigger mission that you're on with Tighten Your Tinkler. I love it all. Thank you for the work
Thank
you're
you
doing.
so much, Lexie, for all that you're doing. And if anybody is feeling called to heal their pelvic floor through our signature program, you can get a $50 off coupon. It's Lexie, Lexie.
Yes.
And it's just for your listeners. And that is always going to be available, no expiration date. And don't hesitate to reach out. We're in all the places on YouTube, our website, tightenyourtinkler.com, on Instagram. And there is no such thing as TMI. It's literally what we specialize in. So don't be a stranger. We're real people and we're behind it all.
I love it. And I'll put all those links in the show notes too, so you all can access it really easily. Thank you so much.
Thank you.
Wow, y'all, wasn't that just an super encouraging conversation with Christina? I love her perspective and just the stance that her and Jenn have taken in their practice with Tighten Your Tinkler in empowering women to have fun while healing with this process. And I learned so much. I mean, from emptying the bladder completely as being like a risk factor for UTIs, to learning about just how the nervous system is connected to our pelvic floor. I think that's just a recurring theme that I keep seeing popping up. And that decompression exercise that Christina gave us will be so valuable. I'll include the link to get that in the show notes as well. We were chatting a little bit after we stopped the recording, but she was saying that even hypermobility is a risk factor for pelvic floor dysfunction and things like that. And that's been a whole nother rabbit hole that I've dove into recently with hypermobility and the relationship with the nervous system, how hypermobile joints can impact the body in a holistic way, and like even physiologically speaking. It's super interesting. I'd love to dive into that in a future podcast conversation. But anyways, I loved the practical advice that Christina had for all of us, that we can tap into using that squatty potty to help. We can focus on those nervous system regulation exercises. And I just appreciated her non-invasive approach to bringing healing to women, and hope in as a even greater thing. So I hope you found this podcast episode valuable. And if you loved it, please leave us a 5-star review. Let us know what you loved about it. I so appreciate it as a small business owner. It really helps just elevate our podcast and get it out there to more individuals. And I think this is a message that so many women will find hopeful and empowering. So if we can get it to more people, then that's even better. Anyways, I hope you all have a great day, and I will catch you on the next episode of the Holistic Ascent podcast.